Thank you. We now move to questions to the Minister for Health. Questions 1 and 5 have been withdrawn, and I call Ciara Ferguson.
Question.
Minister.
On the 23rd of October this year, I was pleased to be able to approve additional regional funding for the Children with Disabilities Service. It's intended that this funding will assist with increasing short break capacity, but also expanding family, therapeutic and behavioural supports. Following that announcement, the Strategic Planning and Performance Group, or SPPG, met with Trust directors as a collective and individually to robustly assess their proposals and their delivery timeframes. Then, on the 7th of November, there was a workshop to review the progress of the Children with Disabilities workstream. Representatives from the Children's Law Centre and Parent Action attended and participated in the Children with Disabilities workstream as part of the Children's Social Care Strategic Reform Programme. My officials have established a monitoring framework for children's disability. It monitors capacity, workforce and need, and this supports accountability discussions with HSC trusts. This will be expanded to ensure the additional funds deliver their intended outcomes. My department recognises the importance of co-design and the value it adds. The framework for children with disabilities has been developed with the views of families and providers to set the priorities for my department and for the trusts. However, it's recognised further work will continue to be needed to ensure that those who use these services are better involved. Meaningful co-design requires capacity and relationship building with families, and as this process takes time, it will be challenging to ensure co-design is meaningfully built into the allocation of the recently announced additional funds this year, but I would hope to see better as we move forward.
Ciara Ferguson.
Can I thank the Minister for his answer thus far? Minister, could you throw some light on how the Health and Social Care Trusts will continue to work collectively together to obviously see how they can maximise service delivery across the whole of the North?
Sure.
And I thank the member for a supplementary question, and it takes me to a point that I came to early in my tenure as Minister. We have 5 geographic trusts for what is a relatively small geographic area and indeed a relatively small population at just under 2 million people. But rather than introduce what I believe might be the distraction of a major reform and say one geographic trust for the whole of Northern Ireland, what I've said to the chairs and the chief execs is that in my mind I'm looking upon the 5 trusts as one, and so I want to see an end to competition and more collaboration and cooperation, and I think that is particularly important in this area where resources and where the actual buildings when respite care may take place are in such short supply.
Brett.
I thank the Minister for this announcement of funding increase. It's a vital service, and can I thank him for that. One of the main providers of respite care in my constituency is the Northern Ireland Children's Hospice, and I was delighted that the Minister recently visited them to hear of the funding difficulties that they have had. Could the Minister provide an update on his engagement and what further funding he may be able to provide to this vital service?
Minister.
Well, I thank the member for his question, and I applaud his continued interest and support for the Children's Hospice. As he says, I visited the facility as well as the Northern Ireland Hospice one day a few weeks ago. Very impressed with the facilities. Very impressed, in fact, at the Children's Hospice in particular with the level of joy. And that may seem an odd statement to make when you have children who are suffering from life-limiting and life-threatening conditions. But there was pure joy in the air. And I came away with a determination to do what I can in coming years to try and increase the funding for the hospice. And this is before we look at the increase on costs that are going to develop for hospices, not least with the national living wage and with the increases in national insurance. And I was also taken by the fact that there is a potential for some form of match funding, should I be able to find some funds to increase what the Northern Ireland Executive puts into the hospice through the Department of Health. So while I can make no absolute promises to the member, I would say to him it's very much on my radar, and if I can, I am determined to do so.
Danny Donnelly.
Speaker, and thanks to the Minister for his answers so far. I would just like to ask the Minister if he's had any engagement with disability organisations such as the Centre for Independent Living to determine how best we can support people with disabilities to live independently in their own homes.
Well, I thank the member for his question. Directly, the answer is no. I have not personally been involved. I would be more than happy to meet, but the member will be aware that my officials meet all sorts of groups on an everyday basis. And if there are proposals, I would expect them to come to me in the normal course of work.
Diana Armstrong.
Thank you, Mr. Speaker. Thank you, Minister, for your answers so far. I welcome the additional funding, which has come as a lifeline for a system and a service under real strain. And we must remember, of course, the families and young people at the heart of all of this. How important, Minister, how important a partner does the Minister believe the community and voluntary sector is in the delivery of these additional actions?
I thank the member for her question. I believe very much in the power of the community and voluntary sector to deliver. I think this goes back to my time as a Victims Commissioner when there were dozens of community and voluntary groups who were providing day-to-day assistance to victims and survivors of our long 30-year conflict. And certainly within the provision of health, if the community and voluntary sector were to collapse, I think it would have a very profound impact on our ability to deliver health care here in Northern Ireland. The member may be aware that I worked with NICVA, the Council for Voluntary Action, on a redesign of the core grant scheme. This is a scheme that had been basically closed to new organisations who have come on stream in the last 20 years. So we now have a new scheme. What I'm hoping to do in the next financial year is perhaps find a little bit more money to go into that scheme. Currently it sits at £1.8 million per annum. I would like to see that increased in the years ahead.
Justin McNulty.
Minister, a welcome £13 million funding package has been identified to help address respite services for children with a learning disability. Can you provide more detail on how and when that money will be rolled out? And further to the previous member's question, can you outline if those in the community and voluntary sector can avail of the funding through it? And you will know of such organisations as the wonderful Gateway Club in Newry who are willing and able to step up to the plate in that regard.
Minister.
Well, I thank the member for his question. The additional funding of £13 million begins next financial year. This financial year, the quantum is more in the order of £2 million. As I have said previously, it is intended not just for short break respite for families, but also in expanding family therapeutic and behavioural support right across the community and across all 5 geographic health and social care trusts. In terms of his specific interest, which is aligned to his geographic representation, it would be the Southern Trust who would be the ones to ask about supporting the likes of Gateway and exactly where this money is going to be spent.
Trevor Clark.
Question number 3.
Minister.
Now, the impact of the pandemic was felt keenly right across Northern Ireland in every household and every sphere of life. As a result, work was previously paused in a number of areas across public health policy. However, where possible, key issues were focused upon, such as the development of the new substance use strategy and the introduction of legislation on smoking in cars, where children or young people under the age of 18 were present. Within the Public Health Agency, around 80% of resources were directed to COVID-19, with the remaining resource focused on issues such as rebuilding public health programmes, including screening and other interventional work on smoking. The majority of ongoing PHA work relating to COVID-19 has now been absorbed into business as usual mode. The COVID inquiry is ongoing. I expect it will inform the priorities for the Department into the future. For now, significant efforts are underway across a range of areas to drive forward progress on a range of public health priorities. We continue to work across government to deliver Making Life Better, which is the overarching strategic framework for public health, through which the Executive committed to creating the conditions for individuals, families and communities to take greater control over their lives and be enabled and supported to lead healthy lives. Existing health inequalities were exacerbated by the pandemic, and I recently launched the Live Better initiative, which looks at how we better align our existing resources and services aimed at improving access and outcomes for those most in need. The pandemic has also led to a significant emphasis on preparedness and response planning for future health crises. We're learning from experience and focusing on building resilient health systems capable of responding to pandemics or public health emergencies, which includes investment in public health infrastructure and in workforce training.
Mr Clark.
Can I thank the Minister for a very fulsome answer? And I think no one doubts the impact that COVID-19 has had in many, indeed the health service as well. However, many are now expecting, after almost 4 years, that many things should get back to business as usual. Should that be appointments with your GP? Many people complain they can't get that face-to-face appointment, and indeed hospital appointments have been affected by that. So can I ask the Minister when or what work could be done to bring back some form of normality where people can get back to the health service that they used to have?
Minister.
I thank the member for his follow-up question, and indeed I'm sympathetic to the point that he makes, because on a constituency basis, ever since the pandemic has hit its peak, I have constituents, as I'm sure the member has, who come in and talk about the number of times they have to phone before they can get through to their GP. I certainly look at the productivity in terms of the 5 geographic health trusts, particularly in terms of elective surgery, and it's not back to pre-COVID-19 levels, and I've yet to get what I consider to be a logical and reasonable explanation as to why. So while I can't answer the member's question in the detail I would like to, what I hope I can assure him is that it is on my radar, and I am determined to get to pre-COVID levels as soon as possible, and then to exceed it, because it's very important that productivity is what it should be. And I could say to the member, we did put the trusts on notice some time ago about their productivity, and for the first time, certainly the first time that I am aware of, we're now beginning to claw back money from the trusts for elective procedures which have not taken place, but which were scheduled.
Ella McAllister.
For his answer, during the pandemic, a lot of the public health priorities were actually shifted from one body to another, so that certain bodies, or whether it's hospitals or community and voluntary sector, could help those that were overwhelmed with the adults that were suffering from COVID. But that balance hasn't really been struck again in terms of actually shifting the responsibilities back. So can the Minister actually commit to assessing that situation, particularly when it comes to the resources that were never shifted at any period? And there are some organisations here that still carry the burden. Despite them reaching out a hand to help during COVID, they are now still burdened with the responsibility and resources from the time.
Well, I thank the member for the point. I'm not aware of the specifics, but I would encourage the member to write to me, and I would be more than willing to take a look and see how we can maintain and achieve a better balance. Absolutely.
Thank you, Speaker. Whilst there's no doubt that the pandemic had a major disruption in public health priorities, I'm glad that the Minister has had such a clear and such an immediate focus on public health inequalities. Can the Minister give an assurance that, despite the pressures weighing down upon the system, that progress will continue to be made with his Live Better initiative?
I can certainly give Mr Chambers that assurance. In fact, I think I will be having a meeting this week looking at the latest stage of the development of the Live Better initiative. And Mr Speaker, it's maybe worth putting on record that initiative is about tackling inequalities, health inequalities. And I always go to one particular statistic, which is 2 women can be born on the same day in the maternity unit in Belfast. They can grow up a mile apart. But if one is in an area of the greatest deprivation and the other is living in an area of the least deprivation, then their healthy life expectation will vary by 14.2 years. And I say to the House, in a first world country, a quarter of the way into the 21st century, that simply should not be countenanced. And it is beginning to address that that I have asked officials to bring forward the Live Better initiative, and it will be demonstrated in 2 areas, one in West Belfast, one in Derry/Londonderry, and I hope we will get from that the empirical evidence that we can make a difference. And then I will take it back to executive colleagues, because tackling these things is an all-executive challenge. We believe it's 20% health, but 40% socio-economic, 10% environment, and 30% behaviours. And behaviours include things like smoking, So the tobacco and vapes bill going through Westminster will help. It's also the abuse of substances, including alcohol, and that's why I would like executive colleagues to support the introduction of minimum unit pricing for alcohol. So I say to the member, yes, Live Better is very much on course for delivery in 2025.
Question 4, please.
Mr.
Within Northern Ireland, Meals on Wheels, or cooked chilled meals, are provided or arranged by trusts for vulnerable people, where an individual needs assessment and it shows that a person is unable to obtain a nutritious cooked meal and would be at risk of malnutrition if such a meal service was not provided. The inability to prepare a meal may be assessed as a temporary or a long-term inability, and the meal can be provided directly by the trust or by the independent sector, either within the person's own home, in the form of a cooked, frozen or chilled meal, or in a daycare setting. There's a criterion for entitlement to Meals on Wheels and a small charge to the person in receipt. The South Tyrone area sits within the Southern Health and Social Care Trust. The Southern Trust do not commission this service, but there are other options available for those who are unable to make their own meals, such as shop purchase ready meals or ordering and delivering of cooked meals from other organisations. The Southern Trust would provide home care services to heat these meals if the service user was assessed as requiring this support. The Western Health and Social Care Trust do provide Meals on Wheels to service users. Within the Fermanagh area, there are currently 6 people who receive a meal delivered to their home. There are also 4 day centres within this area where a person can receive a cooked meal from the Meals on Wheels service. These day centres include Kesh, Killadees, Drumahaw and Tirnaver, and the number of people who attend the day centres can vary between 20 and 80. The cost to the individual is £1.50 per meal. The Western Trust subsidise these meals, and the cost per meal to the Trust varies from £2.99 to £9.48 per meal, and that depends on location and delivery of costs.
Ms. Dolan.
Minister, I appreciate you may not be aware, as I know how busy ministers are, but I submitted this as a priority written question on the 24th of October, and I am yet to receive a response, so I'm grateful for your answer today, and it was comprehensive and very informative. I've been in touch with the Western Trust several times on this issue, and unfortunately they have not been able to provide me with a pathway in which my constituents should refer themselves for assessment for the need for Meals on Wheels. And I know you're not across this on right now, but I'm wondering if you could follow up in writing with me as to how my constituents might refer themselves for Meals on Wheels.
Minister.
Okay, I thank the member. On the first point, I can only sign what comes to my desk, and I'm more than open to a direct approach if things aren't happening at the pace that they are supposed to happen. And I can certainly write to the member in terms of trying to establish a pathway within the Western Trust for your constituent, because if they're in need of a Meals on Wheels service, then they should get it, and they should get it promptly to avoid malnutrition.
Question 6. Cathal Boylan.
Yeah, question number 6, please.
Minister.
The Children and Young People's Emotional Health and Wellbeing in Education Framework was launched in 2021. It's jointly funded by my department and the Department of Education. A number of important projects and pilots have been taken forward through this framework, collectively providing help and support to children and young people in relation to their emotional and their mental health. These include the Emotional Wellbeing Teams in Schools project, the objective of which is to ensure post-primary schools are aware of appropriate pathways for support. That project commenced in the financial year 2023-24, and in the current academic year of 24-25, it will engage with no fewer than 50,000 children in 68 post-primary schools across the region, and that's an increase from 46 schools in 23-24. The Resilience in Education Assisting Change to Happen programme has engaged approximately 8,000 pupils across more than 100 schools. This is an Education Authority Youth Service programme for 6 to 19-year-olds to develop positive emotional health and increase their readiness for learning and also build their resilience. The Being Well, Doing Well programme supports schools with their current policies and practice to embed emotional health and well-being in their schools. In 23-24, a total of 132 schools participated, with 160 schools projected to participate in 24-25. Also, a regional integrated support for education, or RISE, health-led multi-professional early intervention team has been established for primary pupils up to primary 7. This aims to support younger children with their emotional health and well-being needs. The project has supported small groups and provided whole-class support to 242 schools in financial year 2023 to 24.
Mr Boylan.
Thank the Minister for his answer. Minister, could I ask you if you intend to use the Thrive framework as a guide to developing a person-centred, needs-led approach?
I thank the member for his question. I have not taken a position on that, but I do believe that Thrive is a programme which delivers very positive results, and I'm more than happy to take that recommendation back to the department and contact the member in due course with a response.
Alan Crawford.
Thank you, Mr Speaker, and I thank the Minister for his answers thus far. Can the Minister provide some examples of other practical initiatives that are in place to support mental health in schools?
Yes, and the aim is to provide intervention at the earliest opportunity to ensure schools are aware of the appropriate pathways for support in their local area, and indeed within CAMS, the Child and Adolescent Mental Health Services. Additional initiatives include a school nursing pilot, which is a public health agency-led pilot, currently operating in 5 post-primary schools across Northern Ireland, with a school nurse located in the school. There's also a text-to-nurse service, providing a secure and confidential text messaging service for young people between the ages of 11 and 19. And this provides access to a school nurse for advice and support. Then there's the Attach project, TAP, which focuses on trauma-informed practice and the importance of relationships for children looked after, providing training and support to staff who in turn support the child.
Mark Durgan.
Mr Speaker, I thank the Minister for his answers thus far, in which he has outlined a range of initiatives and interventions taken by his department and the Department of Education on this very important issue. I have to say, in all my time here, I've rarely, if ever, come across a project as well received and as well regarded as the Happy Healthy Minds project, and I would ask the Minister if he has been or will be working with his counterpart in the Department for Education to seek the reinstatement of this vital piece of work.
Minister.
I thank the member for his question. I'm more than happy to engage with the Minister for Education on that specific. I can say that I have been engaged with the Minister of Education on a number of specifics, and most recently we met 4 principals of special schools to discuss the health, physical and mental well-being of pupils, and I think we're advancing well in terms of improving services within special schools. I intend to visit some special schools alongside the Chief Nursing Officer as part of the preparation for the next phase of meetings with the Minister and those principals. So I can certainly incorporate that recommendation from the member in our discussions.
John Butley.
Please.
Minister.
A total of around £130 million of funding is provided to the Trust through the mental health programme of Care Route, and that's for the provision of frontline services in mental health. This does not include the funding for the important role provided by the primary care sector. In addition, the mental health strategy funding of £5.9 million has been allocated this year, most of which is being used for frontline service provision in CAMS, crisis specialist interventions and early intervention and prevention initiatives. Each trust is required to submit monthly performance figures in relation to commissioned activity to the SPPG, that's the Strategic Planning and Performance Group. Where additional funding is allocated, there are robust mechanisms in place to monitor service delivery, including post-project evaluations. The Mental Health Strategy for 2021 to 31 recognises that the effective delivery of mental health services is not possible without the full integration of the community and voluntary sector, with this sector having an important role to play in supporting mental health promotion, prevention and early intervention and statutory mental health services. To support the delivery of Action 17 of the Mental Health Strategy, a review of the scope, scale and capacity of the community and voluntary sector will be undertaken this financial year. Harnessing the skills and experience that exists in this sector is of utmost importance, and the mental health strategy envisages the community and voluntary sector as true partners who are fully integrated in ensuring improved outcomes for the population and fully including the sector in the planning, development and delivery of mental health services.
Ms. Bunting.
Thank you, Mr. Speaker. I'm grateful to the Minister for his answer on this important subject, but I'm advised by those in the community and voluntary sector who undertake a lot of this frontline work, particularly around mental health crisis, that when additional monies have been allocated in the past, it has seldom reached them, and instead it's often absorbed further up the chain by bureaucracy, administration and strategy, rather than being spent on the people who need the help. So what action will he undertake to review the systems and processes and to strip away some of these additional layers, thus allowing the funding to reach the point of need and pay for vital services on the ground? Thank you.
Member for a follow-up question. As I think I've already made clear, I've been working with NICFA, the Northern Ireland Council for Voluntary Action, on the specific of the core grant scheme to make sure that it is opened up for the first time in some 20 years. And therefore is available to some groups who have been formed within the community and voluntary sector in that period. And I would like to enhance the pot of money that's available to that fund. As a more general point, in my 6 months in post, I would say to the member that I rapidly came to the conclusion that we have really overcomplicated the delivery of healthcare, really overcomplicated it. I haven't got to the bottom of why, and I'm still grasping with the challenge of how to simplify it. But certainly in terms of voluntary and community sector groups, what they want to do is get themselves involved in a very simple regime where they can access government money, government funds, government support, government resources to do the job that they are there to do. They are focused on helping people. They're not focused on being bureaucrats, on being human resource managers, on being accountants. Their primary ambition is to help people in the community. And so I would like to simplify how we can engage with them and enable them to do what they want to do.
Robbie Butler.
Thank you, Mr. Speaker. I'm sure the Minister will be well aware that mental health is a cross-departmental priority underpinned by a new decade, new approach. Can the Minister outline, therefore, any specific bids that he has made to his executive partners in regard to investment in the mental health workforce?
Well, I thank the member for his question, and he will know that I have campaigned on the issue of mental health and well-being since coming to the House in 2011. In terms of the specific, I have to say in October monitoring there was no provision and there was no invitation to make specific bids. So while I rejoice in the fact we have a mental health champion in Professor Siobhan O'Neill, who I think does really good work in terms of raising awareness, and while we have a mental health strategy over the 10 years of 21 to 2031, we don't have the funds that I would like to see devoted to this very important area. But there are so many demands, as the member will know, on the budget of the Department of Health, that it is very difficult to squeeze out a little bit of extra money here and there. But I assure the member, as I said in my first remarks in this role in this House, that core priorities for me would include mental health, and so it remains.
Andy McMurray.
But I would ask, just you reference engaging with the community and voluntary sectors. I would just ask really how that is being carried forward in order to maximise the expertise they have in delivering such an important service.
Minister. Well, I thank the member for the question. As he is aware, there are many charitable organisations, community and voluntary sector organisations, who are involved in health delivery, whether that's physical or mental health. I have engaged, as I've said, through the umbrella body, NICFA, the Northern Ireland Council for Voluntary Action. I have had, I couldn't tell you how many times I've met individual charities and community and voluntary sector groups. I would applaud the many cancer charities who have come together as an umbrella organisation. I think that's a really sensible way forward because it is sometimes very difficult when you have very limited funds, and maybe there's a range of 12 charities all in the same area, such as cancer, in deciding how to allocate those funds. So this is co-design, if you like, in action when those charities all come together, have an internal conversation amongst themselves, and then come to the department to say, this is how we think you can get the best bang for your buck. So I would be encouraging that sort of collaborative working within the community and voluntary sector, and always eager and open to meet and discuss the way forward. And I would just want to emphasise, because I do feel sometimes some people look on them as the cheap alternative. I do not. They have expertise, they have reach that we cannot replicate. And again, I go back to my days as a victims commissioner. They know individuals, they know families, they know communities much, much better than a government department can ever hope to do.
Moving to topicals, Colin McGrath.
I've received information from the Minister's department, and can I ask, does the Minister agree with me that 149 people dying while waiting on an ambulance here in the last 5 years is totally unacceptable?
I agree with the member, and a lot of work is being done to try and be more efficient, and the member is very aware, because he highlights it, and quite rightly so, the amount of time that ambulances and ambulance crews spend outside and within emergency departments waiting to discharge their patients. And the same goes for the Police Service of Northern Ireland, and the member will be aware that the Chief Constable is very keen on introducing the right care, right person approach, which will recalibrate how the police service engage in terms of mental health patients in emergency departments and questions around that area. So yes, I agree with them. It is a shocking statistic in a first world country, and it's not something anybody is trying to ignore or brush away.
Thank you, Mr. Speaker, and I acknowledge what the Minister has said. Do you believe that maybe some of those 149 people are part of the 97,507 individuals who, whilst waiting on an ambulance arriving, had to have their category of seriousness of their case upgraded because they've been waiting so long? What are we going to do that we can get our ambulance service up to the standard it needs to be to support those staff who are worked to the bone because they are working day and night to try and provide the service for people in our community?
Well, again, I would think the member would be aware. I think we've been recruiting 48 new paramedics to join the Northern Ireland Ambulance Service. NIS have also been reviewing the data, so you will know in your area they've come to the conclusion that they can adjust their rotas, that they felt that the number of crews who were on duty, say between 2 and 6 a.m., I think, was over capacity in terms of the demand, and that it would be better to reallocate some of that resource to late afternoon where demand was highest. So it's not as if nothing is being done to try and address this, but the statistics that the member brings forward are absolutely shocking. They're not acceptable, and we need to do more. But he will know himself, to make a positive difference, you don't just need funds, you need appropriately trained and committed staff, and you need other resources. You need the physical infrastructure to do these things. And I don't think anybody in this House would say that health has been anything other than underfunded over a significant period of time. So sadly, these things are going to take time to fix.
McGuigan.
If I could ask the Health Minister if he agrees with the World Health Organization statement published last week on the 2nd of December that universal population-wide public health approaches are required to prevent gambling harm.
Sir, I have no difficulty saying that I agree with that, and I know Mr McGuigan has a particular interest in this area, and I know that there has been a tripartite approach from this Northern Ireland Executive, including myself, the Minister for Communities, and I believe the Minister for Education, trying to get more resource from the UK Government in terms of tackling this problem here in Northern Ireland, and I hope that will bear fruit in due course.
Mr McGuigan.
I thank the Minister for his response, and further to his response, the Minister will recognise that currently gambling-related harm isn't officially recognised as a public health issue. If I could ask the Minister if he agrees that it should be recognised officially as a public health issue in the North.
I thank the member for his follow-up. I know it's always dangerous to make up policy on the hoof, but I think actually I am on record at an event in the Long Gallery as saying that I think it is a public health issue. So I am happy to concur and agree with the member.
McReynolds.
Sir, can you give an update on the commissioning of ADHD services in Northern Ireland?
Yes, I thank the member for his question. As you are aware, there are no commissioned ADHD services in Northern Ireland at present, but there are services being made available by the Geographic Trust. Provision has grown across those trusts just in response to population demand. And so while that means that there is a level of provision available, it's also led to inconsistencies, which is something I want to see ended. As I said earlier, I'm looking on the 5 geographic trusts in my own mind as one trust. And what I'm saying to them is, in certain areas, geographic areas, you will find pockets of best practice. Let's identify those areas of best practice and let's roll them out to become common practice right across Northern Ireland. I think that includes adult attention deficit hyperactivity disorder, ADHD, as part of that. As to any decision to commission adult services in the future, that has to be based on an assessment of demand and, of course, in the context of future budgetary availability. But officials in my department are now well advanced in commissioning research to inform a future ADHD service by scoping out the level of demand that there is. And I am keen, and I believe so are the officials, that this research will be completed before the end of this financial year.
Mr McReynolds.
I thank the Health Minister for his response and for that update. In the absence of a commissioned service, what is your assessment of those with a private diagnosis of ADHD having their shared care arrangement reviewed, being given a deadline of 180 days before access to their life-changing medication withdrawn, and then redirected back into the private provider with no access to treatment in the meantime?
I thank the member for his follow-up question. That is an area of detail that I would like to take away. As a kind of general comment, I have to say that moving from the health and social care, the National Health Service, from HSC into the private sector and then coming back again poses problems right across the board as far as I can see. The members mentioning specifics, I would invite them to write to me and allow me to take that away and give it the detailed response that it deserves.
Mr.
Speaker, we continuously hear of the constraints in the health budget. Will the Minister of Health pull funding to the Rainbow Project in light of the advice they have published on their website telling people that they should keep a supply of post-it notes to snort powdered drugs and people can still consent to sex if they are a bit tipsy or a bit stoned?
The Department of Health has no worries over what organisations place on their website. The Rainbow Project delivers valuable services, in my experience, to the LGBTQ+ community. So I would not in any way condone illegal activities, and the member may wish to write to the Rainbow Project to highlight what he believes to be the issues that he raises.
Thank you very much, Mr. Speaker. Health Minister, is it a case of you provide public funding to this body and you're permitting them to do whatever they want and say whatever they want, even though it may go against health advice?
Mr. Speaker, I think I've already said to the member I do not condone anything that would be considered to be illegal, but we do have free speech in this country, and we do not have any contractual arrangement with the organisation that he has just referenced in terms of their communications, their marketing, their advertising or their website.
Buchanan.
Thank you,
Minister, my question relates to a paediatric gastroenterology, and apologies if I've got that pronunciation correct. I have a young 8-year-old girl in my constituency waiting a year on a camera test. Why is this?
Well, I sympathise with the member and his constituents. I'm afraid it is a question of resource. This is a very technical medical procedure and is carried out at the Royal Belfast Hospital for sick children. Plans are underway. There is a validation. In other words, a consultant is going through the list just to make sure that people are in the right order in terms of the priority of their clinical need. There is a plan, I believe, to introduce another list in the Royal Belfast Hospital for Sick Children. Also, though, looking to the South Eastern Trust and specifically to the Ulster Hospital to see if training can be introduced which might allow for these PEG insertions to be carried out outside of the hospital for sick children.
Thank you, Minister, so far for your answer. Minister, I listened attentively to your response to Mr Clark earlier with respect to output on pre-COVID levels. Is this an example the example I gave earlier? Is this outworking of this? And to follow on from that, is the private medical sector up to 100% pre-COVID levels?
On the first point of the question, I'm not aware. I have a sense that actually demand for this service is growing, but I'll certainly take that away, check it out and get back to the member. On the second part of the question, I have no worries over the productivity of the private sector.
Thank you to the Minister for your answer so far. Minister, can you give us an update if you are considering accessing the early access programme for Givinostat for children with DMD, Duchenne muscular dystrophy?
Well, I thank the member for her question. She's got me. I am not aware of this condition and not aware of what we're doing, if anything, within that regard.
It wasn't my intention to get you, to be fair, but if you could come back to us with an update, it really would be appreciated. So there is an early access programme. It has not yet been approved for licensing in the UK, but there is an early access programme, and it would be very gratefully appreciated by the parents here. These children have a life-limiting condition, and it is extremely life-limiting. So these children will not live till be a very old age or even a very young age in many cases. So they really need access to whatever treatments are out there. So if you can give us a written update, we would appreciate that. And I think the Chair of the Health Committee has also written to you on this.
Sure. Yeah, well, I will more than happily take that away if the member will write to me. Just as a matter of kind of broad principle, we follow NICE guidelines of the National Institute of Health and Care Excellence. So if they have approved something, we will certainly check for its applicability here in Northern Ireland. If NICE haven't approved it, we tend not to, although it can be done through an individual referral pathway.
Lila McAllister.
If you could tell the House if you are aware, your department is aware, whether or not the estates management team at the Belfast Trust advised against taking the handover from the contractors at the new maternity hospital on the Belfast site, or were they advised to take over the contract?
Sir.
I'm not aware of them being advised not to take the handover. I think there was a contractual board in place who were giving advice between the contractor and the Belfast Trust, and I think the advice was to, figuratively speaking, accept the keys, and it was only afterwards when they went into that solid state of water testing, which was the solid state that applies as if the hospital was fully operational, that the issue arose.
That concludes questions to the Minister for Health. We now move to an urgent oral question. Matthew O'Toole has given notice of an urgent oral question to the Minister for Infrastructure. 9 members who wish to